Going. So welcome YouTube. I'm Claudia Mühlenweg. I am the creator of the Natural Clear Vision Method. I help people like you who want to look for a natural solution to improve your eyesight naturally, to get out of glasses, contacts, and avoid surgeries. You know, maybe you already had LASIK, but the gist of it is you can improve your vision at any age and with any condition. And that's the key message I want to give you here today. But this is not about me today. I actually have a very, very cool guest that I'm so excited about talking to. And she has so much knowledge that we probably have to bring her on for a couple episodes. Let me highlight her video so that you can see her. And welcome. Hi, Dr. Denise.
Hello. Hi. Nice to be on your show. Thank you very much.
So tell us, basically, you are a retired optometrist. So you've done optometry, but when we had our little private conversations beforehand, you told me how you got really bored with optometry. So tell us a little bit about your background and how you ended up doing what you're doing, which is a holistic behavioral light therapy-based approach to vision problems and other brain challenges, right? So tell us a little bit about your own story or your own journey.
Yes, thank you. So I actually was pushed into optometry by my father. He was in optometry, and so I managed to stay there for 10 years doing the usual stuff, selling glasses, and then began searching actually for other alternative processes. So I did iridology. I then studied Chinese medicine. I had various other esoteric energetic processes that I learned, and still I continued on with vision therapy. I tried to incorporate vision therapy into my practice, and then I was about to leave, and suddenly I discovered light via Jacob Lieberman. Actually, I didn't know he was an optometrist. He didn't know I was an optometrist. I was in Cape Town, he was in Hawaii, and so we had a telephone conversation in those days, because this is about 30 odd years ago, and still even that conversation was really all about light and consciousness. And I just thought, this is amazing. I'm leaving optometry. I'm going to do this. So I began working actually with first machine I bought right behind me, and it was only after about 6 months of working with light with Jacob that I then said, I have to do more. I want to meet you. What are you doing? And he said, I'm going to a conference. Come and I'm going to do a few meetings as well before it. And only then he said he was going to the Optometric Syntonic conference. And then we discovered that we were both optometrists, in fact. So
that is so funny.
So then I went to the very first meeting in St. Louis, and went back to South Africa and thought, okay, I'm going to start this. Began doing the color visual fields that were really the most important diagnostic tool for using light through the eyes, because it tells you how light deficient you are, in fact, how much your autonomic nervous system has diminished or been traumatized. So I got the machine and began with a friend of mine who had cancer, and she'd been using a variety of different healing processes. And so I did really basically the first person that I really worked with was her, and we worked together for 3 to 6 months or so. And on that first day, when I did her fields, there was a strange dip in her field that I didn't understand, because I hadn't. They didn't teach you what happened when the field was distorted. And
can you quickly interrupt, but can you quickly explain to the listeners, when you say a field, like probably some people don't know, maybe they think of aura or energy, but you're talking about something more specific, correct?
Yeah, yes, it is a color visual field. I can show you if you like.
Yeah, share your screen. That would be awesome.
Okay.
I think that visual is always great to kind of understand, because this is kind of a deep dive into some of the more advanced approaches, right, to vision.
Yeah, it's okay, so let me see if I can. Well, I can just show you this. So this is a color visual field. This would be a normal field. This large one that's out at 30 degrees. So that was the field that I was doing, and all of a sudden she couldn't see. Now that tiny little field is one that you could, but it was similar to one of these fields where it was very, very low. And on my desk happened to be my iridology chart, which was normally hidden behind my chair because I used to hide these things from my patients. I didn't tell them all the work that I was doing. And so the cleaner had picked it up, it had fallen off the wall, and she put it on the desk where I was. And as I turned to look away to think, what's going on? What's happening here? And I realized that at that point, that 90-degree line is the connection to Lifeline. And even though she had said to me, I want to live, I don't know why, I've got this cancer, and she was working through it on an emotional level. But as I looked at this, out of my mouth came, you don't want to live anymore. And she burst into tears, and I was horrified because I really had no intention of saying that. And she said, no, you're actually right. I don't want to live anymore. And so that began this process of, it was, oh my goodness, I just picked that up from the iridology chart for the field, the visual field. How can this be? Is this a map for the visual field? So I saw her every week. She did light, she came back, she told me her journey. She went through a huge emotional journey, meeting up with all the people in her life that she wanted to apologize to, or that she wanted to, discuss all of their issues and all her family and friends, and she worked through an enormous amount of emotional stuff. Dreams came up, all kinds of emotional processes came up in this real journey. And it was a journey for me as well as for her. It was really a profound process, in fact, for both of us. And at the end, her fields opened to as wide as this one that you see in front here, this 30-degree field. And it was astounding. It was as though she had come from that tiny little field and opened up both sides, right and left, and they both indicate your internal and your external life and how you are managing and functioning. And then off she went, and I thought, she's going to be healed. This is amazing, because I'd done this whole thing with Jacob, and actually lots of people did go through healing processes. So off she went, but then her cancer came back with a vengeance. She had lung cancer, and she died a few months later. But she died, as far as we all went through a grieving process after that. It was really a year's worth of process. But I realized that actually she died with a full field. All of the processes that everybody does, all of the spiritual processes that people go through, is precisely that: to die with a full field, to die with your energetic field open and ready to go, ready to move forward into whatever you perceive or believe comes after death. And so for her, it was a wonderful experience. For me, it told me that when you have a full field, you can still die, because at that point, when I really knew nothing about what all of these patterns were showing, I thought that actually if our fields were really tiny, like this little field here, this teeny tiny 2-degree field, if our fields were that small, that we would actually be dying. But that's not the truth. What's happening is you've closed down to such a degree, and actually this field is the field of an autistic person. It is also the field of someone who has been so terrified or traumatized by events. I had one woman, who'd had a gun held to her head, and she hadn't left her house for a year after that event. She survived a very traumatizing burglary, basically it was, in Cape Town, and her field was that small. And so it turned around my thinking that, when we die, our fields must be small, and when we're alive, when we're living, then they must be big. Yes, they must be big, but that doesn't mean that we're not going to die, or it doesn't mean that it's an indication that we are not going to pass on. So
this is so fascinating. So this is so fascinating, and I love what you said, that your assumption was, the field is small, you're about to go, and the field is large. But I love what you said. You're ready to actually leave for this large field. And I'm sorry about your friend. I mean, obviously we were hoping for a story where she, continued to live, but I think this shows so much. But just for everybody listening to, can you just explain a little bit? So when you go back to the bigger one, we see the red, the green, and the blue line, right? When you do, so this is called a visual field assessment, correct? And so just quickly, technically, before we get into more details. So this is basically where you look at a center point, and then can you explain a little bit how this is done, so we understand what we're looking at?
Yeah, it's a measure of your peripheral awareness, or your perceptual awareness, or your peripheral vision. So it's any one of those aspects, and it is a recognition of the color. And you look at the little sun, the little central dot right in the middle there, that little sun. You look at that point all the time, and then you, without looking away from that, you have to say when you first perceive the color. So it's not movement, it's not crispness of vision, it is a perception of color when it is either the green. We typically use 4 colors, white being the gross kind of field, the one that everybody should be able to see quite easily if your vision's good, and then we do green, red, and blue, and those different fields indicate different things. And in fact, in the mid 1800s, I have a field here that was done by Freud and Charcot. Charcot was actually a gynecologist, and of course Freud was the psychiatrist. And in the mid 1800s, where before medicine was separated into their specialities, they were all sharing information. And so Freud was really fascinated by color visual fields, and there you can see there's a yellow field there done as well. So this one is from the 1800s, and this particular shape of field, I can analyze that field and what happened to that person by putting an iridology chart on top, and not only an iridology, adding in all of the other aspects of energetic medicine and different spiritual beliefs onto a field that tells me all about your chakras, all about your organs, all about your male, female desires or needs, your external, internal life. And this, because it's so flattened, it shows that absolutely he's had head injury, because that's the top part of the iridology chart is the head and the neck and the shoulders. and the bottom part is the body and the legs and the organs. And so that flattening of the field on the top means there's been head injury, which this chap, in fact, had, you know, in the mid 1800s, they had a lot of railway accidents then, because the railways had started, and they had some terrible accidents, and then the insurance companies had started to get in on whose responsibility is this, and so these patients were being kind of shuttled around from discipline doctor to doctor, try for the insurance companies to fight about who's going to pay for the bills. Basically, it was
Wow.
really all
Nothing has changed, right? Nothing has
yeah,
changed.
it hasn't changed at all. It's all the same. And so what happened was Charcot, and of course he was, you know, dealing with women, and Freud had said, oh, women are hysterical, and hysteria comes from women and women's wombs and all the rest of it. And so Freud had done fields that looked like this, and he said that is the field of a hysterical woman.
Oh my God.
But in fact, it wasn't. It was the field of a traumatized man who'd had the railway accident. And so Freud, actually, to his credit, which is, I think is actually quite astounding. I'm not a Freud fan, to be honest, but he went off to the Vienna medical meeting, to the medical chambers there, and he presented this case of the hysterical man, and they all kind of laughed at him, threw pies at him and everything, and said, don't be ridiculous, you can't possibly have a hysterical man. Well, so now actually what they know is what it was called in those days, or a few years later, was called railway spine, and that was because it was a railway accident and it affected their spines, it affected every aspect of their bodies. But there's a lot of information on that kind of process and what happened to people. And of course, then the sort of hysterical woman sort of faded away, and it became neurasthenia, and then it became stress, and yeah, you know, basically it's now regarded as stress, although this kind of field shape does not have a diagnosis attached to it in the medical domain. They just say there's field loss here, there's field loss there, but they start looking for brain tumors and all kinds of other aspects to it. Where in actual fact, if you look at an iridology chart and you see, yes, he was definitely hit on his body, because that's where it's drawn in there. He was hit on his head. His whole system is in this oval shape, which is very much a hyperactive. It's the kind of shape that I've also seen with a hyperactive thyroid. And I know that also. So lots of my journey with fields, because from that moment with my friend onwards, it was like anybody walked in the door, I'd grab them and say, I want to do your field, you know, or if anybody had any problem at all, it was, I'm not going to charge you. I just want to know what your field is like and how to do it. And I experienced, I had a hyperactive thyroid myself, which was healed through a shamanic process, completely healed. But I know that during the time that my thyroid was hyper, my field was oval as well. So it's very much an indicator of a hyperactive system. But so
it's so fascinating, Denise, Dr. Denise. So I mean, oh my God, this is my people here in the Zoom call are saying it's fascinating, and I have to look on YouTube too. But so share, like, so basically these field assessments are also done for glaucoma, but our topic today is really mostly traumatic brain injury. Yeah. And you mentioned the connection to dementia and obviously, you know, vision problems. So I don't want to really interrupt you, because this is so interesting. And I love how you ended up becoming this researcher, right? You're like, I'm just going to figure this out, because this is something that hasn't been done before, right? The combination of visual fields and iridology and looking at the whole picture.
Yeah.
So, you know, and we don't have to switch right right now, but I'm interested in that kind of concept of what you can diagnose with these visual fields.
Well,
and also, did you tell me when we chatted beforehand that nowadays they're done just with white light versus this approach which uses the white light and the green and the red and the blue that's not as how, like, let's say you have a glaucoma suspicion and they do a visual field assessment. It's not the same, right? That it was.
It's not the same. I mean, there are certain, like toxic amblyopia, they will do that you find red fields diminish and various other things. But normally, and in fact, I have never, in all the time that I have also had, many eye checks and glaucoma checks and various, I got shingles in one eye, which caused the whole process to happen. But no ophthalmologist has ever done a color visual field on me. So color visual fields are very much the domain of, well, that really began with medical doctor Spittler, who in the early 1900s, 1920 or so to 1930, he was a medical doctor and he did research into all kinds of aspects, but he was looking at eyes and looking at the connection and also the fields. So there was lots of interest in fields and color fields in that, as I say, in that period from sort of mid 1800s to mid 1900s. And then it all changed because it became computerized, and then it was all fancy and smart, and they kind of cut out all of the colors, and they just decided it was not, bringing pointers with dots on them in from the periphery. It was little flashing lights that you had to determine when you could see them, and it's the intensity of the light rather than where it's coming from that is tested, and the pattern of that shows an ophthalmologist whether there's glaucoma or brain tumors or whatever issue they're there for. So medicine doesn't do this test, and in fact it even CSO, the College of Syntonic Optometry, they straddle alternative medicine and regular medicine, because the color visual field is looked upon as being a perceptual test rather than a medical test. But in actual fact, it is the primary diagnostic tool to show you when your nervous system has been totally trashed because of trauma of whatever nature. It doesn't make any difference. This field that I've pulled up here, this little field, you can see this is.
Can you make that full screen, Denise? Is there any way you can hit like play or something so we see it a little larger? Just asking.
Let me just see.
Usually I think it's going into play. I don't know PowerPoint, but if not, then it's okay. It just would be nice to see it a little bit larger. So yeah, presenter view. I think that's it. I think then you get into, oh no, that shows the whole, that shows.
If I go, oh man, it's a while since I've done this.
It's all right. I mean, if this is also okay. I mean, yeah,
sorry, I clicked the wrong button there. So anyway, these fields were someone who had many skiing accidents. He's a skier, regular skier, has been for most of us, 60-year-old, and also was diagnosed at the age of 60 with ADHD, and has had significant issues with memory, and not diagnosed with dementia or Alzheimer's, but certainly of a nature that's heading that way. And he had 2 sessions on my monochrome dome. Okay, just 2 sessions. It's a 10-minute program. I I tell people it's a program where you can go through all of the colors, the entire rainbow, and you're supposed to be able to go through it yourself. It is a narrow bandwidth light source, so it's a very powerful machine, even though it's, it looks quite sort of subtle, but it's very powerful. And so I direct people to whichever end of the spectrum I know that they need. And for the for trauma, for head trauma, for brain injury, for dementia, for Alzheimer's, for just about anything that you perceive as trauma related, whether it be emotional, physical, or mental, it is the violet indigo end of the spectrum. And so I told him to stay on that end of the spectrum for the what he actually did was he turned it to the violet and then he left it there. Now that is an indicator for the entire 10 minutes. Now that's happened before with me with some of the children that I have seen, where if you leave it on violet for an entire 10 minutes, and that is as I say, that's a really powerful process. That means that your system is utterly traumatized, totally and utterly traumatized, and the only thing that you want is the deepness of that violet color that actually just soothes. It's like a soothing blanket that just goes over you, that stops the sensation of anxiety or trauma. And as I say, I've seen that in kids before, which has been really, it was quite disturbing for me to see. I have once in my own life experienced that, where I just thought, I am so stressed, I'm so anxious right now, and I sat down and stuck it on violet, and that was it. It stayed there, and it absolutely calms you very, very quickly. So he did another session about 12 hours later, and the field, that's the change in field that happened just with 2 sessions of 10 minutes of light. Now, what that shows is that there's a lot of strengthening, opening, solid lines in the bottom of the field, which is his physical legs and body. The top aspect has improved. The color fields have all expanded. The top area is the brain. So that first of all, it tells me there's hope, because he was brighter, crisper, clearer, talking more normally, remembering things, a much better mood after that. And that was, one day, basically over a 2-day period. Unfortunately, he didn't believe in it. He said, "Nah, it didn't really do much. Yeah, I had a dream, weird dream," he said. And actually, he said, "Violet's my favorite color." It's so that's always an indicator you really need it. So he hasn't continued on, and sadly, he's not actually improving now. He's going back down again, because there's no way. He's on medication. He's on a pile of different medications, which are just, as far as I'm concerned, they will. It's just toxicity for your liver, for your general system, and light is absolutely so subtle and so all-encompassing. It's not like it aims at an organ and that's it. It's only healing one organ, or it's only healing your eye. Light comes to us from the sun and basically cascades through our system, through the hypothalamus. So the eyes are the superhighway to the brain. So that is the process that if you're taking it in through your eyes, it's the fastest route to your brain, to your nervous system, to the limbic brain, to the amygdala, where all of that trauma is stored, and cascades through. So it means your whole system gets a wash through with the frequencies that are soothing and calming. So yeah, that's, there are many people who have gone through trauma head injuries and all kinds of really scary crime events that I have seen where they have persisted with it and opened up their fields and have overcome some of the most terrible trauma. So it's even children who fall and bang their heads frequently when they're learning to walk, and then, you know, playing rugby, then all of those children should be having checks, and preferably light, to expand their fields again, because if you don't, they will end up having fields very similar to this, which means they're just not going to function as well. Then what happens is they go off to the doctors and they start prescribing or diagnosing them as ADD, ADHD, when in actual fact, perhaps it's just been, now I'm not saying this is all entirely this, but when you've had a few head injuries, even a tiny little bump, it is enough to pull your field in, because that's an instant reaction for our bodies. It's a survival reaction that we can't stop it from happening. And if you've been tired or stressed, or you've had other issues happening, or you've had surgery, then already your field will have diminished a little bit. And then, of course, bring COVID into it, and it diminishes even further, because suddenly your whole world disappears and all of your connections disappear, so your field comes in even further. If you bang your head then that brings it down even further, and then you will start having issues that you're going to think, oh no, I'm getting dementia, I'm becoming senile, or I'm just not functioning at my best, or I'm grumpy and irritable because I keep forgetting words, or not able to do the things that I used to do. So it has a profound effect on all of our systems on an ongoing basis. And unless I don't know of any other method that has changed people's lives to the degree that light through the eyes does.
Wow, this is so interesting. We do have some questions, but I'm also curious. So as our topic is traumatic brain injury, and I was just thinking as you were talking, oh my God, how many times did I hit my head on a cabinet? I mean, on a car door, like I mean, you know, we've all hit our heads, you know, probably hundreds of times by the time we're like 50, 60. So, and now I'm wondering if I should actually, get one of those scans. But let's come back to the topic of like dementia, because so is there a connection in terms of traumatic brain injury can actually cause dementia, or is it more like the limited visual field? And also, how do they know that they have a limited visual field, or is it only this test? Or like, how do you even know? I have so many questions. So I know that's a bunch of them at the same time, but
yeah, people don't know, because that's not one of the tests that people do. It's just it's never done. Most of the vast majority of optometrists throughout the world do not even know about this. They don't do it. Is dementia caused by head injury? Repetitive head injury definitely has shown. There is research already. It's, you know, you can go onto the internet. It's all over there that repetitive head injury will actually produce dementia. Maybe not Alzheimer's specifically, but certainly dementia and aspects of memory loss. And still they're not checking. I can't tell you how many people I have emailed and said, please, will you please let me come and do a little research project with you and do some fields, and I'll tell you what's wrong with this patient, and you can tell me whether that actually is correct. In fact, there is a chap in Australia who has just taken fields, and the work that I did, it was a presentation I did to the Australian College of Syntonic Optometry there. on field analysis. So he took it all and he put it on a computer and has run through a whole lot of fields and analysis with it, and put the iridology chart on top. And he said the results from that were, he was totally shocked that the results came back at 90% correlated and to the iridology chart and what it teaches, what it tells you on fields, on distorted fields. I said to him, the only reason you got 90% is because you don't actually know how to correlate those fields. If I were to look at those fields and read them, because he doesn't know how to read the fields, he was just correlating with the iridology chart. It's not just a matter of, okay, look at the organs on the iridology chart. It's also about what the cycle of those organs, like the Chinese medicine process of the cycle of 5 elements and combining with the right and the left eye as well. So there's a little bit more to it than he has used in his research, but still 90% correlation to that the iridology chart matches with what the patient fields look like is a remarkable percentage. So yes, it's not done. It's crazy. This is really a biomarker. It's a biomarker for everything, not just a traumatic brain injury. I saw many children from one of the top private schools in Cape Town who were, all the kids who were playing rugby. And of course, they had to be in the top team. And when they're in the top team, everything else, nothing else matters. They just got to win the game, And so there was one particular child who had been doing vision therapy and light therapy. And I used to do vision, well, for a very short period of time, I did vision therapy and then decided, I don't think that works. I stopped doing it, but then when I started doing light, if I do light before vision therapy, it opens up the fields. Then the vision therapy is easy and it works and it's fantastic. And of course, it's like getting fit. If you've been like this a lot of the time, not moving your body, and then somebody makes you feel relaxed and open, like the light does that, then you want to start moving your body and getting everything fit and coordinated again. And that's how vision therapy really should be done, as after a process of light. But I had already done light on him. We'd opened up his fields. They'd been very tiny. He came because he was ADHD, basically not functioning at school very well. And he'd had a couple of concussions on the rugby field. And so we worked with him, opened up his fields, and everything was fine. And then he came back in again, and wham, they're down again. And his mum said, he's just been at rugby again, and he had another concussion. And because his fields came down really significantly, I said he shouldn't go back on the field again. No, you don't understand. There's a game. He can't not go on the field. I said, okay, well, do the light, but do it now and don't not do it, because otherwise he's going to be in a really not a good place as far as his brain is concerned. I mean, he was only about 14 or something, and so off they go. They come back again. His field's open, not quite. They stop light. They go off. He gets another. He had 5 concussions in one season. And I said, I'm not treating you anymore, because this is insane. You're going to have brain damage, permanent brain damage, if you don't actually stop this. And his mother just said, well, sorry, rugby's more important. So,
That's crazy.
It's a choice. We all make choices in our lives.
Right.
I mean, I have made choices that weren't the best for me, for sure. But the thing is that it is It is the fastest, quickest, least expensive, most comfortable way of actually determining, do you have an issue with your autonomic nervous system? Has it actually gone into a state of fight, flight, freeze, feign, or, you know, the entire bundle? Or how is it being impacted and affected? And
Yeah, this is so interesting. I mean, we have some questions, and I'm just wondering, so without doing this kind of test, like somebody could say, oh, I'm stressed or I had trauma, or, but you don't be like, this is not the same as visual field loss, where you don't, like, describe to us a little bit, like for dummies, you know, when you have, let's say, glaucoma and you really don't see something in your periphery. Is this in real life, or is it like you do the visual field test? Or would that person also in traffic, like, not see the car, you know, or the pedestrian or the bicyclist? Is that the same kind of situation, or is this different? I just want to totally understand the difference.
people generally don't know that their fields are diminished.
Mhm.
I didn't. I mean, I certainly had to, and because I'm so old, I had to do these color fields when I was at university, which is a long time ago. They don't do that any longer. They haven't done it for I don't know how many years. But I did. I was trained in doing these, and when I first studied optometry. It's not used now, so I've just lost my track with the question you asked me.
Well, it was about the, you know, like, you know how somebody doesn't have peripheral vision,
All right.
glaucoma, they drive and they make a right turn, they don't see that bicyclist, or is that the same kind of peripheral vision loss then?
Yeah,
Yeah.
that would be, yes, it would be thinking, oh my goodness, I just didn't see that person came right out of the blue from somewhere. I didn't see
Right.
that certainly when that happens to you, then you must know that your field has definitely diminished. But many people don't have any idea. They know that their functioning is not as good. So very many people are too scared to actually even speak the word, my memory is not very good any longer, because it has such dreadful connotations, you know, with Alzheimer's and dementia. And so people almost try and forget about, or they try and push it away to pretend it's not really happening until they come and, you know, if they come and have fields done. And one of the questions would be, are you having difficulty remembering things? Or in fact, I don't even go there with questions like that anymore. It's really, have you had any head injuries? Most people forget the head injuries they've had. And dementia and Alzheimer's patients totally forget because their fields are so diminished. There's no way they'll remember if they've had a head injury. It's just,
So with chicken or egg scenario, it would be like the head injury comes first, that causes the dementia and the loss of the peripheral field,
yes.
which, right? So, okay, this is so interesting. We could go on for hours. We have to have you back, but we have some questions on the YouTube. So first of all, Jammer, I don't know how to pronounce the name, said, can you explain vascular dementia? And I don't know if this has anything to do with this vascular dementia.
No, I don't think I could actually explain that, other than to say that possibly that is related to your vascular system not functioning very well, that you may have miniature strokes or miniature clots, or that are related to that. So in terms of, well, so would light help that? Yeah, light is going to help. I can't say everything, but certainly it's because our systems are primed to go into a state of fight flight. The moment that something appears out of the blue and gives you a fright, then it means that throughout a lifetime, that that capacity to go, oh, and then renormalize. Okay, so again, and renormalize. Well, you may get a fright and then be far too tired and too stressed and too shaky to be able to renormalize. So you don't renormalize. So then it stays there. And then the next one comes along, you go, okay. And so that's how it starts to move in. So when you start opening that out, it is profound for people. It's really profound. But I had one patient who had not driven for 20 years because she'd had a car accident. She had whiplash. She didn't have much more than that. She was myopic. She'd had LASIK. She came to see me. I had not seen her prior to this. So she came to me because she knew that I was doing holistic optometry, basically. And her vision was reducing again. And she said, does she need to go for more LASIK, or what's the story? And so I checked her, she was 3/4 to 1 diopter. So she'd been on plano, on no script. They'd managed to get rid of all of it. And she was basically at a minus 0.75, -1 prescription. So when I checked that, she said, okay, well, I suppose it's only LASIK. And I said, no, don't go anywhere near LASIK again. Why don't you just let me do a field and see if light might help you, and perhaps some vision therapy, but let's see. So she agreed, and we did a field, and her field showed that she'd had a head injury. In fact, she hadn't even told me about her head injury. You know, we'd been discussing LASIK and myopia rather than any head injuries. And so I said, you've had a head injury? And she said, yes. She didn't tell me that she hadn't driven for 20 years. And I just said to her, okay, well, first of all, we can get rid of the myopia because that is what light does as well. And in fact, it happens to be the same program as a trauma program. So myopia and trauma head injuries come on the same color frequency wavelength. So I gave her the program, and off she went for 2 weeks, because that's the typical period of time where I would do a field, give a program, 5 days on, 2 days off, 5 days on, 2 days off, and then they come back for another field. So she came back and sat down and said, well, I don't know, what did you do to me? I don't know what happened. And she said, well, first of all, she said, I have a stepson he and I have never got on. We just hardly talk to each other. She said, he turned up at my house, and for the first time, something strange happened. And she said, the words that came out of her mouth were, I saw him in a different light. And she said, we just had this really good conversation, and so we somehow or other have been able to communicate with each other. The first night of the light, she said also, I've forgotten, the first night she had diarrhea, but diarrhea so sudden, so unexpected, for no reason, that she was shocked. And now that's our belly brain, you know, so the belly brain relaxes, allows you to let go, release, and start releasing. And if you have that kind of experience when you've just begun a light program, even though it's a bit and can be a bit unpleasant, it's nevertheless a fantastic signal that your system has just said, I can relax, this is amazing. And then she said to me, well, I said, oh, well, that's amazing. And how about your vision? And she said, no. She said, there's something else. She said, I started driving. I said, what do you mean you started driving? She said, I haven't driven for 20 years. Her husband had bought her a really nice little sports car, She refused to drive it because she was still traumatized from the 20 years prior. And so she's had a driver, and she just got in the car one day and then got out and said, "You can have the day off. I'm going to drive my car today." And so she just spent the day driving. And so I was completely shocked. She went through the entire program, opened up her fields, got rid of the myopia, carried on driving, had a great relationship with her stepson. And at the end, she donated a really significant amount of money for me to work on anybody who didn't have money to go through the process. So she was a very grateful and remarkable person to work with. So
what a beautiful story. I don't know if you have more slides to share. Otherwise, if you want to stop the slideshare, we have a couple of questions. First of all, so Christina is asking, if we go to a psychologist and work out and deal with our past trauma, do the eyes feel better?
So, okay, my view of and experience of trying psychotherapy myself, and EMDR, because I've had some traumatic experiences and flashbacks of traumatic accidents that I've had. So EMDR, which is eye movement desensitization, is to me it was traumatizing. It traumatized me more, and that I only discovered afterwards, because it was only after that I found light, is that my fields were small, and when you do EMDR, you're looking from one to the other field, and basically my fields were too small, so it was like trauma, each time, because my field was not big enough to hold those two targets, and so for me it re-traumatized me. And I know when somebody's got a very small field, then psychotherapy takes a long time, because you're doing it through a talk experience or a talk method, maybe a meditative method, and if you are re-traumatized in the process, then your field's going to close down, so you won't necessarily. And obviously this is not so with every psychotherapist. It's a process that certainly will take longer than when you use light. If you use light with a psychotherapist, it's brilliant. And there's a guy called Stephen Vasquez, and very many psychologists actually, who use light with psychotherapy. So if you find someone who can combine those two things, then it's just the most astounding process.
Wow, I wish more people would do this, and I wish they would do that for driving tests, instead of testing visual acuity when it comes to actual driving skills. Your field is so much more important, and you're being relaxed than reading letters on an eye chart on a static object. Anyway, that's a side note. So Kevin is asking, and is this light machine, and just to be clear, this is a so-called Syntonic machine. And that's usually, I know you want to educate a little bit about Syntonics, and that's the field of optometry. But he's basically asking, is it available for general purchase? And I know that already. No, it's not, right? So what is your...
Well, actually, yesterday was the International Day of Light, and there were a lot of lectures. And one of the guys that I've known for many years, Anadine Martel, who has a company called Sensora, his instrumentation is absolutely astounding. It's really, really amazing. I've experienced it. It's incredible experiences with it. The only thing is they're seriously expensive pieces of equipment, okay? But he has just, or don't know how long, but he's just made something called Sensolite, Light. There's something else called Senso, Lite, but he is, if you go onto sensora, I think, .com, then you will find it. And it is a very inexpensive instrument that also has the 40 hertz that research that they have used with dementia. So I ordered one last night, literally straight away, and so I am going to work with that and see what it does with fields, because Anad's got, he's very knowledgeable on that. So yeah, as far as the syntonic colors and process are concerned, yes, they're controlled processes with the medical and optometric associations. You can get goggles, filter goggles, and I mean, I sell them to my clients. So that might be a process that would be of interest, and I don't know who else does that. I also do teach and show how to just use the gels, get filter gels, and you can get that from Stage Spot, the ones they use on stage for stage lighting, and the combination of those that you get, you can use.
Great, this is awesome advice. And we have one more question. Solange said, I need help with my field vision. What can I do? I mean, other than finding someone like you, I know you're in Wales. I do want to meet you. And I think you're still working with people one-on-one in person or online, even though you're not like officially, right? You still work with people if they beg you, or
Yeah, I am. Yeah, so I do. I work online. The only thing is I can't do a field online, unfortunately.
right.
But I can certainly assess. I can assess what you would require in terms of light, because it's because of all the other knowledge around energetic medicine that I have, and Chinese medicine, and shamanic medicine as well. It's basically that gives me the information that I know what kind of process you would require, and then I can go ahead with it. The nice thing about a field is that it is this incredible visual experience for patients or clients, where they know that they couldn't see in certain areas. They had no idea that was, because it's new for everybody. And the second time they do it, they have this, they come back and they know that that they're seeing better, things are brighter, they're brighter in their minds and their heads, they're moving forward with things that they were stuck with before. So there's this real excitement about seeing your field expand, and then going through the journey of, okay, so why is it dipping here? Well, and it's like, okay, I can see perhaps you are still anxious about speaking out in your external life or your internal life. You're not feeling like you have enough courage to say what you really believe. So all of that information comes up, or there's some aspect with heartache, or it just gives you a story about your life that you can go, and then you incorporate that into how you decide you want to go forward. So it's like this, I didn't even know that about myself. It's well, now I don't want to be like that. I want to be like this, and so you can actually, you've got something to work towards, because you can then see your field expanding. So that's a really powerful and very exciting process to go through with people, which is just so sad that I haven't been able to do that during the COVID period, but I've actually been able to do things online, and it's been a very positive process. So there's certainly, you can achieve a lot even online.
And we will make sure that to put all your information in there and how people can reach you. I mean, we have a couple of questions here on Zoom, and usually we have our little Q&A privately after the YouTube live stream, but I do feel like some of these questions could be interesting for everybody. So I might as well ask those. So first of all, one question is, what do you do with people that have color, that are colorblind when it comes to like red, green? How do you do those field assessments?
So even colorblind patients have, you would show them the target and say, okay, what color does that look to you? So if I have the green target, and then I just say, what does that look like to you? And they'll say what color they think it is. And then I say, so then just tell me when you think you see that color. So it's a recognition of whatever that color looks like.
Right, got it.
The only thing is that with colorblind people, certainly they seem to take longer for their fields to open than people who are not colorblind. That's one thing that I have definitely seen. So but it still opens, it just takes longer.
So this is not a question in the chat, but I have this question. So you've talked about the myopia improvement. So have you found improvements in other refractive errors like astigmatism and farsightedness and presbyopia with the color field there, like color light therapy as well?
Certainly with hyperopia, with ESO squints, the exo squints as well. I had one young guy who was going for his pilot's license, and he was, I think, a +5, and he was esophoric as well, and his vision was really reduced. The program for that is red, orange, and lime, and it is brilliant. It is, for him, he had no trauma specifically. He was so in other words, if you've had trauma, then you have to negate the effects of the trauma before you can actually deal with the core issue of the long-sightedness. Or the short-sighted, whichever, but it's specific with long-sightedness because you have to go to the opposite end of the spectrum. So, but yeah, absolutely, it does improve. It reduces scripts and straightens squints, and
I do want to see you, because even though my depth perception is not perfect, my right eye still sometimes turns in. I see that usually when I do selfies, I'm like, oops. So we have one last question here before we come to a close on YouTube, and we're going to have a little mini chat here. So one of my Clear Vision Club members is asking, I had some visual field testing done because of my early glaucoma with an ophthalmologist. Tests were pretty good and eye pressure was way down, but the top of my left eye field had areas with no perception showing, and this has corresponded with my lazy eye. I'm not sure what to do with the lazy eye. Was thinking maybe some practice could help, but maybe I'm trying to read all this, maybe because it's blocking some perception, and maybe it's leading to some vision loss there, that I could tape it up a bit when I'm home. Like, I think she's talking about patching or something. So I don't know if that makes sense, what I was just reading, or so the top of the left eye had field loss, and that's also the lazy eye, basically the left eye, the amblyopic eye.
So what was really amazing for me with one glaucoma patient she'd had some surgery done. She had lost, so theoretically she had lost a whole section of one of her field on one eye, and that was visible in the field. It literally had disappeared. So I was not expecting that field to come back. I was expecting the rest of the field would open up, but I certainly didn't expect that field to open up. Well, it did. So the supposed blind irreversible wasn't irreversible at all. It reversed. It opened up. And what happened when she came back was she said, so we did the field, and she said the ophthalmologist doesn't know what's going on. And I said, no, I know they don't know what's going on. But it's, and she said, but you know what's also interesting? She'd gone through a winter where she had for years and years and years, she'd had asthma throughout winter and throat infections and all kinds of things. And so, and sinus as well. Well, that winter, because it so happened that she'd done the light therapy process just before winter. It was the first winter in her life that she had not used her pump and all of her medications. She said she didn't have any asthma and she didn't have any problems for the entire time. Now, that area that had opened in her field was her lungs. It was the lung area.
That is so interesting. I think we should write a book with all those stories, and yeah, like you need to write a book with all those stories.
I did. There are
Oh, you
two
did?
books I wrote, yes.
Oh my God, I didn't even know. We need to put the links into the YouTube show notes so people can get those books. That's amazing. We didn't even talk about the books. We already talked for an hour. I was like, I have to have you back for like 3 more episodes. This is so interesting. So we have to come to a close. And so we will have a little bit extra time with the Clear Vision Club folks here. So thank you everybody on YouTube for watching. And if you're watching this later, please post your comments and subscribe. And do you have any kind of social media, Denise? Any place where people can, you have your website, denisehadden.com, right? Any other place where people can find you?
Not really.
That's okay.
It's like, no, not at the moment.
That's okay. It's okay. There's a website and you can connect with her there. And I'm sure your books are listed on your website so that people can also.
LinkedIn is the only other place that I.
Oh, LinkedIn. Okay. All right. Well, thank you so much for being here and helping us navigate through this super interesting field. And I think I wish this would be part of every protocol in terms of trauma treatment or driving or, like you said, and even with ophthalmologists, it's amazing to me that I'm curious how open they are to the kind of work that you're doing, or is there still that kind of divide? Because with my method of natural clear vision, there's definitely, very few eye doctors who are interested in believing that you can work with the brain and actually improve your vision naturally. That's so, but I'm thinking hopefully with your field work, there's a little bit more openness in the eye doctor field, or is that not something that you found? No?
It's beginning to change. It is beginning to, not with the actual ophthalmology, but certainly optometrists, it is beginning to change, yes.
All right. Well, thank you so much for being here. So